Welcome back. I'm a clinical psychologist and I'm going to be doing an AMA, Ask Me Anything. The first question is, how many patients do you see per week on average? This was a great question. I'm going to preface this with, I work in private practice, so I don't have quotas to meet in terms of the amount of patients that I need to see for billing purposes, so I'm able to choose. For me, I had to take some inventory when I first started in private practice because I was like, hey, I have to figure out what works for me, the timing of clients, and the types of clients that I want to see, because you could see, 8 clients a day. And if the modality, the presenting concern, just say you're super well versed in it, just say for me, it's all sleep stuff because I specialize in sleep, that day is going to be a breeze for me. Not because the patients aren't challenging or I'm not putting enough effort in. It's more so a matter of this feels natural for me. And for me personally in private practice, I've had to think about how many clients I see per day, when I'm seeing them, and how often I'm seeing each client. That being said, with all the nuance, I normally see between 4 and 6 clients per day, Monday through Thursday-ish. Depends. Some days are more heavier than others. Some weeks are more heavier than others, and some months are heavier than others. But it's so nuanced. And I don't only do therapy. So I do a lot of other things. I do assessments, I do content creation, I consult with brands and other colleagues and stuff like that. So I have to create time for all of that as well. I do have a hard start and stop time when it comes to therapy. So my earliest client is at 8, my latest client is at 6, and I only have just a few 6 p.m. slots because I start to notice mental and emotional and physical fatigue. And I want to be 100% there for my client. If I'm not able to be present 100%, I think of one of 3 things. I think of it's either the wrong time, I haven't spent enough time for myself getting to a point where I'm able to be fully present, or number 3 is this client might not be good for me around this time. So there's a lot of chatter about if you have clients with a lot of trauma or you work with clients with certain disorders, having the timing of those clients be very important based on what is natural for you. Completely forgot to film an outro, so leave your comments below and I will get to them as soon as I can. Thanks for being here.